Okay, we've gone live, so we will be able to be heard. So be careful what you say.
Okay.
And I'll put up that countdown in a minute, but I want Dr. Green to be here. Oh, there's Dr. Green.
Yeah, I tried it from my computer, so yeah, it's just spinning now. So that's why I said I'll just do it from my phone.
Okay, can you hear us though?
I can hear you fine.
Okay, good. Hey. Okay. So do you have any last minute questions, Dr. Green? We're actually live on Facebook now, but people can't see us. But do you have any questions?
No, because I was just wondering before where the questions that they wanted me to ask, but I could see them before. So I guess just like we in the chat. So
yeah, you'll see them in the chat. We sent you, Nicole in her email earlier sent you kind of sample questions. I don't know if
I didn't see the sample questions. I only saw the introduction.
They were after the introduction. Oh wait, don't hold on. It was okay. In the email says I can't find it now.
This morning or what time? I can.
She sent it this afternoon. I don't remember what it was about. But she sent, and then it was underneath whatever she sent.
All right, and it came from you, correct?
No, it came from Nicole.
Okay, so let me just take a quick look.
Tom, do you think you could maybe put those questions up on the screen for us, like as we go along?
Yeah. So we will. Yeah, Dr. Green, I can put questions up on the screen so you'll know what to ask.
Gotcha. Okay.
Okay. Are you there, Dr. Green? Your screen is black.
Let me just. Okay.
Okay. Good. Okay, so I'm going to put up a countdown in just a second, a 30-second countdown, and then Dr. Green, if you've got the script in front of you, you can start once that countdown is over. Okay, great.
Okay.
So I'm going to get started. I'm going to back myself out so that nobody sees me, thank God. I will remove myself. It'll just be you two on the screen after this countdown.
Okay. Hi, good evening. Can you hear me?
I can. Hi, Dr. Green.
How are you, Dr. Muller?
Good.
great, beautiful day, right? The weather today was amazing in the midst of everything else that we're dealing with. So, good evening, everyone. My name is Dr. Lisa Green. I am from the Family Christian Health Center. And tonight, I welcome you to Ask the Doctor. It's a series by the Chicago Cook County Department, by the Cook County Department of Public Health. And it gives residents a chance to ask their questions about COVID, about the vaccines, about the mask, just any questions that you have tonight that you still need answers to. It allows the residents to be able to ask the expert, to ask a doctor. And so tonight, if you have any questions, please ask it in the comments on Facebook, on YouTube. But tonight, I am very happy to be joined by Dr. Darcy Moeller from the Cook County Department of Public Health. And just so you know, this event is being recorded tonight so that if you want to go back and play it, if you want to share it with family and friends, neighbors, if there are questions that got asked tonight and answered for you that you don't necessarily know how to articulate back and you want to kind of figure out, well, what did they say again? You could always go back because it'll be on YouTube for you to go back and visit. So on that note, let's get started. And we welcome you tonight, Doctor. If you could just introduce yourself and let's get started on your opening comments.
Oh, yeah, sure. Hi, I'm Dr. Darcy Moeller. So I'm the COVID-19 Health Equity Lead at the Cook County Department of Public Health. And I'm so honored to be here with you, Dr. Green. And yeah, we're just here to answer any questions you guys have, anything about, boosters, variants, masking, testing, anything like that that can help you. I will make a little disclaimer. I have a 5-year-old who just started kindergarten. So also you could ask questions about kids in schools and things, but you may hear them in the background. And that's just life. It was a long day of kindergarten already. It's almost bedtime. So, but yeah, let's get to the questions.
So one of the questions that we have right now is the booster vaccine necessary after having a breakthrough case of the Delta variant? And aren't natural antibodies good for at least 7 months? Can you get COVID, once you've had the vaccine? So I think basically that what they're trying to ask is, where are we with the boosters? Do people need them, right? And if you've had a breakthrough, what does that look like for you?
Yeah, this is a great question. And it's sort of complex, right? Because both vaccines and COVID infection create these antibodies in our body. So some of this question is correct, that we do have natural antibodies that help us fight COVID. The main issue is we don't really know, we don't have measurements of what your personal body's reaction to getting COVID would be. So we don't know how long that protection lasts, especially not for an individual. So basically what we've seen in the research is that people who had COVID and also got the vaccine are just even more well protected. But absolutely still people should get the vaccine. And the boosters, we're still waiting for the final say. Whether or not you've had a breakthrough case, it'll still be recommended likely. And it's probably going to be 8 months out from when you finished your vaccine series, your initial vaccine series. So, stay tuned on that. We don't have the official recommendations from the CDC yet, but likely, yes, we will still recommend that, booster dose for people who got breakthrough cases. It's just so that we have more data on what the actual antibody response was to the vaccine than to actual cases of COVID.
Right. Alongside to that, could you take a second and we talk about antibody? And some people have been confused about what we actually mean about antibody. I was at an event this weekend. And so if you could just take a second, based on the comment that she asked before, for those people that don't know what an antibody is, what does that mean? They know we're looking for this and you want it, but what actually is the antibody?
Yeah, that makes a lot of sense. So the antibody, I think the easiest way to think about it is that when you get infected with anything, it could be, a virus or a bacteria, any kind of illness, your body fights it by first some cells recognize that it exists and they find it. So that's you picture the virus floating around, the cell finds it, and then it makes something called an antibody, which is a protein that is specially made to attach to that virus. So it's kind of like if, you could picture even if the virus was this shape, that the antibody would be round, just like that. So they fit together. So those antibodies actually grab onto the virus. And the more antibodies you have, the more likely they're going to grab onto that virus. And if they grab onto it, they destroy it. So more antibodies, better. Less antibodies, worse, right? The antibodies are like your soldiers.
Awesome. Let's see if we have another question. We do. Which is a really good question. Can you catch COVID multiple times? And I think what I'd like for you to do is to answer that question will be helpful, because some people we know have gotten COVID and they feel like they're not necessarily going to get it again, right? But that's happening. So if you could really, can you get it more than once? And if you got the vaccine, does it make a difference?
That's great. And I kind of like how you're thinking about that, because I get that question a lot too, about people getting COVID after the vaccine. So the answer is yes, you can catch COVID multiple times. And the answer to can you get COVID after getting vaccinated is also yes. But so I don't want people saying, well, if I'm going to get COVID anyways, why get vaccinated? Well, so the first thing is it's kind of like a cold or like the flu. You can get those things multiple times. You're not likely to get them close together. So if you get COVID 1 month, it's not likely you're going to catch COVID again a month later, because you'll have, again, those antibodies in there will fight it down too quickly. But you can get COVID later on once those antibodies have kind of gotten out of your system, or maybe as we're seeing with the vaccine, maybe after a while the antibodies will start to go out of our system, right? So then you can catch COVID again. So the reason we still say vaccination is absolutely imperative is because even though you can still get COVID, people are much, much, much less likely to be hospitalized, and very few actually die, which we know that death is not incredibly uncommon if people get COVID. But people who get vaccinated, it's very uncommon. So it's protecting you. And the flu shot actually works the same way. I know I have a lot of patients who say, I don't take the flu shot because I can get the flu, but it's the same thing. If you get that shot, that means if you do get it, you'll get a lot less sick.
Gotcha. Thank you. Okay, this is a little longer one. So, are there any drive-up vaccination sites in Illinois? They read about one in Aurora, but there was no information and no details on the dates that they provided, the Moderna and the Pfizer, and that Illinois Department of Health had no information per se on drive-up vaccination sites, as they are important for people with compromised immune systems needing third doses. So I think the question is, A, are there drive-up sites? And B, are there drive-up sites for the booster?
That's a really good question. And actually, I'm surprised that it says that IDPH had no info, because I think that's usually where I refer to look for where all the vaccine, where you can get the vaccine and what times and what dates. I think hopefully we'll be able to post on our website. If you go to CCDPH's website, we'll be able to post. And I think I'll have to take that feedback, that actually being explicit about whether or not it's a drive up is important. And I agree with you. I'd prefer to have a drive up. And I thought that I had seen that information on the IDPH list before. So we'll also make sure that we post on our Facebook a link so you use the same link that I use to identify some of those places.
Okay. And I guess the other question that she's asking in between, for those people that are immunocompromised, what are your thoughts on them getting it through like the drive-through? Do they need to go to their doctor? If it's available and they are in that category, would you recommend they have access or accessing to a drive-up location when they become available?
Yeah, I mean, I think it's a great idea for sure. Obviously, if people who are immunocompromised are more susceptible to COVID or are more susceptible to, poor outcomes from COVID. So the more you can protect yourself, the better. However, you've got to live your life and you have to be able to get out there. You can wear your mask and keep yourself protected while going out. And if you've had your first 2 vaccines, and this is more about the booster, you do still have some protection from that. So, if it was a question of should I keep myself, should I avoid getting the booster because I am afraid of leaving the house? of course, talk to your personal doctor about it because it depends on your own personal circumstance. But I think for most people, the benefit probably outweighs the risk to go and get that booster dose for people who are truly immune compromised.
Right. And I think a lot of people, if they are, it's hard enough going to the grocery store, people that are immunocompromised try to really limit their unnecessary exposure. So if this is another visit that I have to make, but if I can do it in the comfort of my own car, as opposed to going into another doctor's office or even in a Walgreens or something like that. So I think people might find extra comfort in that while they wait, because there is a 15-minute, wait time after that as well. All right, let's see if there's another question. Oh, this is someone tonight. They said they also have a 5-year-old, and will they have a vaccine soon? He had COVID when he was 4, and he's now 5. And will they have a vaccine available for this age group?
Well, I definitely want to push some of these questions back to you, Dr. Green, but I do feel well suited to this because I have a 5-year-old as well. So I'm right in the same boat with you, Ms. Washington. So hopefully soon. I'm very excited and my son is very excited for when he's going to get his vaccine, because the sooner he gets it, the more he'll be protected. Hopefully soon. The truth is we don't know exactly when. We think it will be, I'm hoping around December. We'll hear from the FDA, basically, and the CDC when it's approved for the next age group. And then the age group, we're likely thinking it's going to be 6 and older. Not 5 and older, so it might be a little bit longer for 5 and under. But just know that the reason it gets delayed is because they want to make sure they have enough data to ensure that it's safe. They've looked at enough people, and then as soon as they have enough data, they'll be making that available. So if I had to make a guess, I would say by the spring for 5 and under. But unfortunately, I can't give you like a for sure answer.
Right. And the one thing I think that we want to remember is in this age group, because they can't get vaccinated yet, but because they can get COVID, I mean, thank God, to the person who asked the question, you had a 4-year-old, and I pray that everything went well, that they're 5 now. So that's a good sign, right? Because that wasn't everybody's story, right? There were some, even though the numbers were small, there were some, younger children that were succumbed by COVID. But I think that just means it's really imperative for the mass, because they're depending on everybody else, us, to get vaccinated for this age group, right? They can't get that yet, but yet they can still get COVID. I think that's part of it. A lot of times I tell people it's not about one of us, it's about all of us, right? Because your decision when it comes to COVID, it does impact your neighbor and the community at large. So I think it's really important that, when I see 5-year-olds, because they want to get out and play, absolutely they should. But in areas, especially indoors with, so many people and not knowing who's vaccinated or unvaccinated, they definitely still need to wear a mask. The good thing is now they can go away with a Superman mask or whatever kind of mask that they want, right? That makes it fun and, interactive for them. But really, that is extremely important. While they wear a mask, while the rest of us, do what we need to do to help protect them until we can get to that point. Because I think you brought up a good point, is we could have just said, okay, let's just give it to everybody now. But the reality of it is the data. It is the evidence-based medicine. It is that information that we're looking at, so that should give a little bit more comfort to people to know that it isn't just a blanket, statement. Okay, here, let's just do this and keep it moving. But it's really, the world, at large is trying to do their due diligence to safely say that when we get to a form that we can execute this now with kids, that it's safe to do. I can remember back when kids had chickenpox and it was, the varicella, and there was one vaccine. Then we realized we need to come back and give 2. Was it safe to give 2? You gave them 1, but now that they're going to get another one, should they, right? But there's information, and there were studies, and there were research, there was research that was put together that found that the cost benefit of giving now 2 made a huge difference. And so we're doing that even more important now with COVID. And as you mentioned, because there's so much that we're still learning. The next question. Okay. When will the booster shots be ready? And people who are immunocompromised, can they get them now? Correct. So yeah, that is the $1 million question right now. And it's amazing because originally you had people, you still have some that have questions, but now I have others that after seeing the Delta and having a little taste of freedom, right? That we had for a minute, around that 4th of July and things like that, people are like, you know what? And because I see the effects of the people that are now in the hospital as well that are facing COVID. And there's a lot of concern that, wow, it protected me for this portion. But if my immunity is going down, then how soon? I'd rather be safe than sorry. I do know that the FDA is meeting the end of this month, no, like the 23rd or something, that they went in that way. After they've done their due diligence enough, then we'll have more information about really distributing it to everyone. But, you want to weigh in and give me your thoughts?
No, yeah, I mean, everything you said, I completely agree with. We're hoping it will be soon. And again, it's all evidence-based, and that's why it doesn't go, kind of quickly. We have sort of ideas and opinions, but they really need to look at the data. And there's a specialized panel within the CDC that looks at the data very carefully and figures out if it's, how much is people's immunity or those antibodies kind of going away. And so if we need boosters, when do we need boosters and who needs them? And they're really looking at the data for that. But the second part is correct, that people who are really immunocompromised can get them now. I know some people, there's a lot of confusion about whether or not they themselves are immunocompromised. And that's definitely a question for your doctor. There's a lot of different conditions that can cause this, but it's very individual.
Absolutely. And the one thing that I remind people is part of the research is not just about, our state, our nation. We're having conversations with, the World Health Organization, all over the world as far as, when we distribute, massively out to boosters and things like that. So again, this is the one thing that COVID really brought us together as a world, because we were all fighting the same thing. And so having that data that we know, in the United States, but also what we see happening globally as well, all of that's being taken into account as we kind of strategically map out what those next steps are as far as the booster is concerned. So I guess I'd also say, if you're someone that is immunocompromised, and you would know that more with your doctor, somebody more immunocompromised than another person. There's some people that may have multiple, what we call comorbidities. And that means they have 3 or 4, 5, 6, different entities that put them at a higher stratified, what we call risk, than someone else. And that would be something then, a conversation that you would have with your, primary care physician to then really map out, is now the best time, and should you get this now again? And so those are areas that you definitely want to have with your primary care physician. A lot of people who are immunocompromised, they know they're immunocompromised because they do have relationships with their doctor. So don't be afraid to ask. This is the time, and most doctors will tell you if they don't have the answer, we're still looking. We don't know. This is one of those things that now, and I tell people, you mentioned as we start the call that you have a 5-year-old. We're physicians, but we're wives, we're mothers, we're aunts, we're cousins, we're neighbors, we're friends, and we are all, have those same kind of questions. So I think people are really trying to be as, upfront and as transparent and as, keeping it simple, real, for people to understand their questions. So by all means, if you have questions, please, seek out your primary care physician. If you don't have a primary care physician, trying to elicit one as well. All right, the next question. Are the new variants, Mu and Lambda, worse than even the Delta variant? Is it possible that the new variants will not be affected by the vaccines? So your thoughts, and then I'll chime in.
Yeah, sure. So as far as whether or not they are worse is, I guess right now subjective, wouldn't be a data kind of a thing. So like, are they more infectious, or are they, do they make people sicker? We don't know that, across the board yet. It hasn't been studied well enough. But is it possible that they could affect people differently? Absolutely. Like, we know that Delta was more infectious, which means easier to be spread. You could be around someone for a shorter period of time, essentially, and get contract COVID. It is possible that new variants will not be affected by vaccines. Right now, we're still seeing decent coverage. people who have been vaccinated with the vaccines we have now have good protection against the Delta variant. Unclear how good that protection is against these other variants. You can think about it again like the flu shot. You know, we recommend getting a flu shot every year, and that's because the influenza virus, changes every year. And it changes in kind of a predictable way, which is why we can predict what kind of vaccine, for the most part, to give that year. But COVID is likely going to be sort of similar. It's a different type of virus, but it can mutate. And as it changes a little bit, whether or not the vaccine will still work just depends on how big that changes. So I will say this is a plug for vaccination now, because the way to stop variants from developing is for us all to get vaccinated. The reason the variants come up is because the virus is still spreading, moving around, and is able to mutate that way. If we can stop it in its tracks with vaccination, then it won't have the chance to create mutations so quickly.
Right. No, absolutely the point. You know, because I have patients that say, well, I got the flu shot and I still got the flu. But let's see the flu symptoms you had. You had a cold, and you might have been and really sick. But we didn't have to put you in the hospital. We didn't have to intubate you. There's a lot of other things that were you uncomfortable? Was it very serious? And it can be, right? And the flu it knocks people off their feet because it can be a sudden. And that was the one thing about that, right? At the same time, though, what we have to realize, to your point that you brought up, is that the more people that are not vaccinated is a chance for the virus to change. Because just like we're trying to get how hard we're trying to get get rid of it, it's trying to make sure that it stays alive. And this virus, I was telling somebody not that long ago, I said, this came with a GPS tracker because it has gone to areas. I happen to have a lot of family that lives in Louisiana. And my God, the hospitals were inundated in such a short period of time. And so I had relatives said, well, why do you think it came here so bad? Well, only 38% of the state was actually vaccinated. So if I'm a virus and I'm trying to survive, and I know that your community is 80 to 95%, I don't want to go there. I want to know where I can go and fit in and survive a little bit longer. And so that's where it chose. The sad part about that is that was a big cost, right? They paid a huge cost. Their hospital systems were inundated, especially smaller communities where they didn't have the manpower, they didn't have the ICUs to be able to do that. But on the flip side, the one thing about, I think, us as a nation, when we realize things are major, it did cause an uptick in people now beginning to go get the vaccine because they then saw firsthand. Now, should it take that firsthand for people? This has been a journey, right? It's been a journey for all of us, good, bad, and different for people's decisions. So I appreciate you, on the call tonight, really being able to try to answer some of people's questions so that we can make those decisions before we're making a decision about events. And I think that's the issue, that so many people, by the time it hit, that was the choice that they were making. So the next question. Do the vaccines have any effect on fertility? And should pregnant and breastfeeding women get the vaccine? I get this question asked a lot. And the data as we know it by the OBGYNs has not proven, in fact, that it has stopped fertility. And originally in the trials, we had patients who were pregnant that did not know they were pregnant and still were able to have a successful pregnancy. And so some of our patients that are actually immunocompromised and pregnant would definitely highly recommended that they still should get the vaccine. And so you want to add onto that. But I will tell you, based on the data and knowledge that we've seen, that there is no evidence that there is a decrease in fertility that we know of.
Yeah, and I'll just add to that second part about the being pregnant or breastfeeding women. We do recommend pregnant and breastfeeding women get vaccinated. I know some people have difficulty with this because they think of it as that the child is getting vaccinated, but it's different. We don't share, the mother and the child do not share blood. We do sometimes transfer antibodies, however. through the placenta when the baby's inside and through breast milk when we breastfeed our babies. So there are likely to be benefits to getting vaccinated for your child as well. If you're vaccinated when pregnant or breastfeeding, we don't know all of the details of that, like how beneficial they are, but likely to be beneficial. Many vaccines are beneficial that way.
Do masks trap? That's a good question. Do masks trap germs in them? I will tell you this year, think about it, Dr. Moore, we had less flu than we ever had. And a lot of time, and you know what? Because people kept whatever they had to themselves. And that's the importance of having the right mask. That's the importance of changing them every day. That's the importance of not using one with the filters on the side. That's the importance if you have a cloth one, making sure that it is covering your nose and your mouth. I think that's the important piece. Do you leave a mask on for 3-4 days to sit there and then you back infect? No, absolutely not. So then you can harbor, like what we call a little petri dish of germs. But the whole goal is that the mask is to protect you and protect the people that are around you as well. It's unfortunate we've made this a political debate, but the studies have shown that for people who have worn a mask, that it did decrease the ability of that transmission.
Yeah. So they do trap germs in the positive sense. They work in that they trap germs from spreading from you to others. And some masks also prevent germs from getting through the other direction, which is why we wear them. But as far as people who are sort of concerned about infecting themselves somehow, I've heard of this, like people are worried that it's unhealthy to wear a mask. And absolutely not. It's just because it's your own air doesn't actually mean that it's any harm to you. The one thing that I think you mentioned, Dr. Green, that is important is that they do get dirty. So if you picture that the outside of that mask after you've been wearing it is covered in germs on the outside, you want to kind of create that model in your head. So when you take your mask off, you're taking it off from the ears and you're washing your hands afterwards. And you're not, kind of like a lot of people adjusting their mask all the time on their face. And, if you're really out interacting with people, there can be germs layered on the outside. So there is kind of things to think about as far as the mask having germs on it. But that's the purpose that it's serving. So those germs land on your mask and you don't breathe them in.
Right. Okay. How should you wash your mask? And, these are really good questions. How should you wash your mask and how often should you clean them? So I guess if the disposable ones, those, some of them can last up to 3 days if possible. But now, it's a much easier to get a supply than it was originally. And so now, depending upon the surgical mask that you have, there's some that can, again, last for 3 days, but others, it's every day. And you change that for those that you buy at the store or that you make at home. I would still, at the end of the day, wash them, especially if they're cloth masks, and I tell people they can wash them in their hand, on the sink, with Dawn or Tide or whatever. This isn't an infomercial for those detergents, but let me stop. Disclaimer. But whatever is hypoallergenic for you, because there's some patients that I have, that they've gotten irritation now from the mask. They've gotten a little contact dermatitis, along the sides of their mouth, or they've got some discoloration and some itching around the nose and things like that. So really be mindful of what you're washing in, because I had some people, they were washing them in bleach and then putting that, not necessarily really rinsing them out with bleach, and then rinsing the bleach out, they were putting it back on, and it was really the bleach that was causing an irritant to their face, or they were soaking them in alcohol after they washed them instead. It doesn't require that. It's in the evening, it's a cloth, it's the other one, throw it out. But to your point but making sure that you still wash your hands each time, and washing them for 20 seconds. It's not the little fingertip, I have little kids. And I mean, when my kids were little, they want to just do it. No, this is not the time for the fingertip. This is the whole hand soap, and ensure that we get in all the crevices and things like that to ensure that we've washed our hands thoroughly.
Yeah, I agree. Second all that.
All right. Is there any truth to the rumors that the vaccine plants a microchip in your arm? Well, no. You know, I said so many people that has been major, right? So there's information on YouTube and social media now that is saying that the reason that cars are delayed in manufacturing is because all the manufacturers overseas have been making chips for the vaccine. And the concern with the chip is that they're going to be tracking you. I tell people, you ask people two questions. Do you have a cell phone and do you have a debit card? I said, those two things have been going on for the longest, right? And so there is not a chip that we know of. And I think it's because people hear technology and messenger RNA. And I think earlier on, we didn't necessarily, people didn't understand what that meant, right? I mean, you have healthcare workers who didn't understand messenger RNA. And you hear technology, and technology says that it's equipment, that there's something in there, that there's a tracking module. And we've gotten good. Things have come up, you know, back when you first had a microwave, you know, food could be ready in, you know, X amount of minutes. And now is that have we gotten to a point that we can microscopically place something in a vaccine that will create a tracking mechanism? And so, no, that is not what's in the vaccine. But unfortunately, the amount of information that is available on YouTube, that is on Facebook, you have to be, you know, careful. Tonight, we're two physicians, but again, we come on as, you know, not just doctors, as, you know, as parents, moms, and everything, like I keep mentioning. And so that was the reason that we spent time, most of us, ensuring that it didn't have a chip in it. Why would I want to give myself a vaccine and I think I have a chip for me or my family? And so we had to really make sure and that the data made sense. Was it evidence-based? Is there not a chip? There's a lot of distrust. And especially if you realize when the vaccine came out, you know, we were dealing with Black Lives Matter, or we were dealing with so many different issues at the time. And because, especially in, in the Black and Brown communities, there has been a long-standing history of, or distrust that has been done, unjust. And so therefore, if I know what's been done historically, then you haven't necessarily given me anything for me to look, prospectively to see that you are doing the right thing. And so I think that people, when they have that question, they have to have a conversation. I'll go back to your primary care physician. Go back to having research, not just, a Facebook or a YouTube that you heard that documented this, and they will show you, the DNA and the helical form of it and how it's been put together and things like that. But I think people have to go back and see who funded that, where did it come from, as opposed to just that belief. So, but I can go on for this. So,
no, I know. No, that's great. And I think you brought up a really important point that there is a well-earned distrust in some communities of the medical system. And I think, to those people, it's important that they speak to people that they do trust. But trusted sources, Facebook isn't a trusted source. YouTube isn't a trusted source. Talk to your own physician, talk to your community leaders. The evidence is out there. And I hate to see certain communities suffering more because they're less vaccinated because of distrust. It's an endless cycle. It's disappointing. But absolutely, I agree with your point that we as physicians are also people, and we wouldn't do anything for ourselves that we and for our families. It wouldn't be recommending things for our families and children, and that we didn't feel was completely safe.
Absolutely. And and the next question talks about, speaking of the historical, racist practices, how are people supposed to believe the government or the health department now? And I think it goes back, you may not necessarily believe them, But the people that work with them, that look like you, that are in your communities, that have cared for you during the process, that may not, have the same skin color, that may not live in the same communities that you lived in, but they've been able to work and provide care to you. Those are the people that you trust. Those are the people that when you came out, and whether it was high blood pressure, diabetes, where would somebody bring your kid for a school physical or to be with you with your pregnancy? Those are the people that you look to and trust, right? And when you think about it, and I tell people all the time, when the vaccine first came out, our doctors and staff weren't running in line and racing to say, okay, let me give the vaccine and I'm good. No, there was so much anxiety at first. We did so much research. Not that so I hope the audience doesn't think that we don't normally do research. We do, we do research, and we, to the best of our ability, and we're trained to do no harm, right? That's the oath that we take. It's to do no harm as physicians. Whether we work for a health department or not, that's our ultimate goal. We go to med school because we believe that we've been called to work with our patients to make a difference, right? And so if I'm going to make a difference, I also have to understand the climate and the lens that people come from, right? And so because we individually had to do that amount of work ourselves to say, are we going to be okay? Can we do this? We did a lot of that beforehand. Knowing that there was a lot of distrust and an earned distrust. So let me be clear, and we're not going to sugarcoat it, an earned distrust that people have in our communities. But I think that when you look at Cook County Department of Health and you look at the county system is one of the best in the country. We're not just saying that, because, we're from Chicago and we work with them. But we've seen what they've done over the years. We've seen what we've done throughout, history on a positive side of, people who didn't have care or health insurance. They've always been able to come to Cook County and get the care that they need. The doors have been open regardless to people's ability to pay. And so because of that, and because we know we've had that trust, then we did our due diligence as physicians, as as team members, to ensure that the information that we were providing is to the best of our knowledge and ability. It was true. And again, you have to realize it went to health workers first. So we were the first people that had to say, okay, are we really doing this? And it was anxiety I remember my medical director was like, Lisa, I think I had a panic attack. And we talked about some other things. And those were real conversations for people. And so imagine we have these medical degrees, right? And we're nervous. So understandably so, how the rest of the community, and especially marginalized communities based on what they see. And have we come and cleared a path to say, oh, everything is good and golden? No, we have not. But I think COVID has opened the doors. I think Black Lives Matter has opened us the doors to really have conversation. And we can own those conversations, and we can own what's happened in the past. I think it gives us an opportunity to work together to move forward. But you got to have people at the table that are from the community, that look like the community, that can help.
Absolutely. Thank you, Dr. Green.
All right. Now, does ivermectin actually help cure or treat COVID, even if it's not approved? You want to start that, and then I'll tag along.
I mean, short answer is no. We don't have any evidence that ivermectin works or is active against COVID. Regardless of approval, as far as I know, the ivermectin has been studied and is not effective at treating COVID or COVID symptoms. There are treatments that are helpful. Ivermectin is not one of them. We don't recommend that anybody takes this, especially not from a vet store, I guess is where people are getting it from. So that's
no, absolutely. I think if it was that effective, I don't think we as a world would be holding it back. I think we would be mass producing. I think we've seen enough death and enough tragedies. We've seen the burden on the health system, our own mental health and physical health, throughout these last, almost 2 years now. And so I just think that we have to rely on evidence that we know of. Still, treatment absolutely needs to be addressed. And I'm not negating that fact at all. I definitely think we need to look at treatment as well as vaccination. And I think that is the direction that not just the United States, but we as a world are looking at and trying to study and see, what is the right, what we call cocktail, what is the right, treatment. And is it okay for everybody? We have not come up with a cookbook that says this works for every single person, because COVID, it changes, it moves in people differently. So those treatment plans have to be tailored to the individuals with the skill of the providers that are taking care of them when they're in the hospital. Not you just saying, I heard this works, let me go to get it done. Because even if it did work, right? Even if it does work, you would need to have that in conjunction with the care of a primary care physician that you work with. This isn't one of those that we just say take vitamin D or take some zinc or take a little elderberry. That's not the case. All right. Is there any end to the pandemic besides vaccinating people? That's the $1 million question. So I guess in my from my lens, I think because we've been in it, as long as we've been in it, and we have not been in it alone, right? So they're fighting this in every country around the world. And because of that, and because of, I think, our CDC, because of the World Health Organization, because of the internet, because of their ability to communicate and exchange data at a faster rate than we've ever been able to do that, I would hope that as we continue to get people vaccinated and as we continue to learn more about this, then it will be something that does not completely devastate our worlds, but allow us to be able to kind of move forward. And I'd have to believe that we have to go in a direction that it does not have the impact that it is currently having now. Because if you look at the people that are in the hospital, in the ICUs now, are some of them vaccinated? Yes, they are, but that number is low. The majority of those people that are in the ICUs right now are unvaccinated, and most of them are younger. And so if you look at earlier on, the people that got vaccinated were your higher risk individuals. You're 65, you're 75, you're 80 years old. So the people that we're seeing now in the ICUs are younger than that. And so if we learn and acknowledge what we're learning as we grow, then yes, there is ways to get out of this. I think it is the hand washing. It is what we've learned by social distancing of what we need to do. It is that when I'm sick, it's not okay for me to show up at work, but people do it because they need, their income. But if I'm going to be sick and go to work now, I have to be cautious because it's not just about me anymore. It's about my family. And I think it's those things and those mindsets that will allow us to be able to get out of this, along with collectively as a global entity trying to move forward.
Yeah, well said, Dr. Green. I think, I would add that speaking specifically about the actual pandemic part, COVID is going to be something that we deal with forever. But ending this pandemic and ending the way that we have to modify the way we live, vaccination, I think, is the only way to get there without a lot more disability, death, and economic consequences. Basically, as people get COVID, as more and more people get COVID, people will get really sick, people will die, people who are breadwinners for their families, the impacts on communities will be great. If those people are vaccinated instead, again, they may still get COVID, but they won't get as sick. They won't die. They'll still be here for their families. Communities can stay together. So to me, the better end is the more people who get vaccinated. So the pandemic will end one way or another, but we can mitigate so much harm by more vaccination.
I know. I was just looking at, I don't know where I read, was it the Washington Post or somewhere recently? And I think the number was like 1 in 500 people, had died. It's just amazing when you look at the number of people that have died with no rhyme or reason over this last, during this pandemic everywhere. It's enough to really, pause. And I would hope people would. The problem that we have, as we've been talking about getting vaccinated, is that unfortunately, we have a lot of people who've chosen not to get vaccinated, but also not wear a mask. And I think you can't have it both ways, right? You can't have it both ways. If you're not going to get vaccinated, you have to at least wear a mask, wear it appropriately, and be conscious of your neighbors. Someone has another question. I don't have transportation. How can I get vaccinated? Oh, that's a great question. So I know for us, we're a fairly qualified health center, and we've partnered with Cook County Department of Public Health, and we have vouchers for Uber. So if people want and need transportation, you can call your local, fairly qualified health center. You can look on the websites from IDPH, and once you find a site, then they're able to connect you with transportation. And that's worked out really well for our patients, because some people didn't want to be on a massive bus waiting with people, whereas the Uber ride was the direct, upfront, and personal. It was a gift card. Now, it was not taking you to the mall, but it is taking you for your visit, and then you just call the Uber back. So there is transportation available.
Yeah, and I'll put in a plug for our destination vaccination program. So look on our social media, and it's posted there. You can get, anybody in suburban Cook County can get, rides to their vaccination. So that is available.
Oh, I like that. Destination vaccination. I like that.
I can't take credit for it. That's for our communications team.
Have either of you seen any long-term effects of the vaccine? It feels like we've been in this forever, but it's really only been 2 years, and up to date so far, I have not. I work at a large, fairly qualified health center, and we're in Harvey. We have Harvey, Dalton, and Linwood. And to date, we've been vaccinating all over, the south side of Chicago and the southern suburbs. And we have not had, people that have had, long-term side effects. I will tell you the biggest thing what people have is, as we know, the first shot, people are like, oh, it's not that bad. The second shot, some people had, fevers, body aches. And there are some people that it lasted 2 or 3 days. I did have some people say they didn't feel that they're normal for like 3 to 4 weeks. And you have to acknowledge that. And they just were like, oh, I was just fatigued. I had a headache. But after that 3 to 4 week period, and that was not the norm. Okay, that was not the norm. But in most cases, people went away within that short period of time.
Yeah, I would agree. I would agree with the people that I've seen. It's the norm is either no side effects at all, or side effects for a day, or maybe 2 days after getting the vaccine. And those are really the side effects of a mild, it feels like you have a mild virus. And it's not because you have the virus, it's because your body is busy creating those antibodies that we talked about. And when your immune system is creating antibodies, that's what makes your body feel like that.
Right. Now, there are some women that had noticed lymph nodes, and so there was some concern with women going to get a mammogram right after they got the shot. And so that's when we said, well, no, wait a couple of weeks, months or so afterwards, and then get the mammogram. Don't postpone it, because people notice some enlarged lymphadenopathy, meaning the lymph nodes are where part of your body is fighting up and building up this army in the immune system. So the concern was, well, did the vaccine give me breast cancer? Do I now have lymphoma? And none of the studies have shown that, but they've shown a hyperreactive lymphadenopathy, which means that the lymph node area got enlarged. People monitored that, and they did not see any evidence of cancer or any, long-term, what we call sequelae from that, but we did become cautious. All right. Oh, what is an Fqhc? So an Fqhc, it's called a fairly qualified health center, and there are health centers all across the United States, but all across the state of Illinois. And we provide amazing quality health care. But one of our caveats, we're not a free clinic, but we have what's called a sliding scale. And that means people can work and not have health insurance, or people can be undocumented and need health insurance. And we never turn people away. So we may have a sliding scale fee that you may pay as little as, $20 to be seen. And we still work with people with that. And It allows you to get your lab done, see a dentist, get maternal health care. You can get mental health services. It's a whole comprehensive care from pediatrics up into the end stage of life. They are full scope health centers that are throughout the state. And our mission has really always been, community first and embedded so that people understand the communities that they work and where they live in. And a lot of us, our staff are actually from the community, so they have a different lens as far as being able to understand what that looks like. But again, and people, if they don't have insurance, we help them get insurance through the exchange. People are like, well, what is that? I still struggle with it, and it's a difficult process to do. But Fqhcs have been a staple for several years now that allow us to provide quality health care. Is the vaccine free at fairly qualified health centers? Absolutely they are. There's no charge to get the vaccine, and there's no charge for them to help you sign up to get health insurance, or if you don't have a primary care physician, again, you need mental health services or dental or pediatrics. Most of them are a full scope, and the vaccine, there's no charge for the vaccine. Oh, as we're getting ready to close in time soon, can you discuss the mental health effects of the pandemic? Dr. Green mentioned almost 2 years we've been living with this. What should people do if they're wearing down mentally? Well, people who hear me say, even for my own personal self, you know what? I went to Big Lots earlier on, and I put some deck furniture on my deck, and I went outside to do some gardening. And I tell people, this is the time that you have to recognize, and we always say now, it's okay to not be okay. And having those conversations, I think the first thing is recognizing that what you feel, acknowledging that, and have a conversation with, family members, someone close to you. And if not, seeking out care for, there's so many 1-800 hotline numbers now where the people, and what I try to tell people, the people on the other side of those calls, a lot of times they've been where you are. So they're not judgmental or anything. And it's the ability to communicate and to get you connected. So this is the time to find that end thing that you like, whether it's I want to draw, whether it is I want to dance, whether it is, I want to learn to cook more, but whatever it is that gives you peace, and learning to take the time to breathe. We haven't done that, but COVID has taught us that it's important to just stop, just to breathe. I just had a patient the other day, and I said, well, I know you live alone. I said, well, what are you doing? She said, you know what I do now? I have 3 mirrors. I said, what do you do with the mirrors? She said, I dance. I get up and dance. Nobody judge me. I'm not dancing by myself. She said, and it actually helps. And I said, whoa, okay, whatever it is that you have to do, but you have to do something. You have to do something. And winter's here long. Fall is coming. And so I think it's finding that connect. And whether that's, through a friend, through a neighbor, you're individual, but it's pulling that inside to be able to recognize that this has been a lot. It has been a lot. And how do we navigate through that? But I'll let you answer that as well.
No, I agree with everything you said. And I like this idea of the dancing. I might do it with less mirrors myself. That might make me more comfortable, but that sounds like a great therapy for sure. And I just wanted to mention or add on to that, finding those support systems is critical. And then for those people who don't have those support systems, I think a lot of my patients don't really realize or internalize that primary care physicians, your physicians, are also there for you for emotional needs. I think people think, what do I need to go to the doctor for? Like, I'm not feeling sick, right? But if you're feeling really down and hopeless, your physician can talk to you about that. There are things that we can do to help you get through it and to talk to you about your feelings and help you kind of work through that. So I think that's just important to mention, that there's always that resource.
Right. And to realize that you're not crazy.
Mm-hmm.
I had someone who didn't want to get the vaccine one day. He says, well, I wasn't born normal, because he had, little CP and he had a limp. And I said, none of us were born normal. What do you define as normal? We each have something, you know, that we deal with, right? But know that you're not crazy. Know that it's okay, and reach out. Reach out. And so as we close up tonight, I just want to thank you so much, Dr. Mola. This was amazing. And I hope that people got some information out of this. So please share it on your Facebook, share it, you know, look on the YouTube, look on, you know, the Cook County Department of Public Health. And so I want to just thank you so much tonight for the time, for the information, and the conversation, Dr. Mola. It was like, and we just met tonight, but it's amazing.
I know.
Yeah, we're having a connection just through COVID. COVID did do some good things. So
I know. I love it.
Be safe and get the vaccine.
Get the vaccine. I agree with you. Thank you so much. It was so lovely to meet you. Thank you for having me.
You as well. Bye-bye.
Bye.